Dr. Grace Nambacha Cheyune, Director of Research, Natural Chemotherapeutics Research Institute under Ministry of Health. I'm a PhD in medicinal chemistry. And I also hold a postgraduate diploma in education. I'm a board member of our regulatory agency, National Drug Authority. I've been a board member for 15 years now down the line, and currently particularly on pharmacovigilance committee looking at adverse drug reactions. The topic is exciting, and it's just confirming the critical need of scientific validation in the area of natural products, because lack of that validation has always held behind all issues regarding abuse, because if you don't have evidence, then you can't convince people. Yeah, so it's exciting. It is, and our regulator, the National Drug Authority, has been at the forefront of really sensitizing the public, though focusing mostly on adolescents in schools, because given that Uganda is one country with the youth, the percentage of youth is so high, the focus was on that, but we are challenged by regulations in that area that are not really very strong in terms of penalty, you know? Yes, so, and the issue of truck drivers, as a landlocked country, we have these truck drivers. I think they use lots of such things to stand up to the pressures of long journeys. And so Uganda has been trying really through our regulator, but of course the regulator is under Ministry of Health. Yeah, so yeah, there are efforts, and in terms of also recognizing national days that really talk about what we should do to mitigate, giving out materials with messages to remind us, you know, substance abuse, drugs, alcohol, cigarettes. The drug issue, yeah, is quite strong when you talk about cat, and cat, since is not even captured under the regulation, so it makes it a challenge, really. Yeah. Actually, at the moment, they're mainly organized in associations. If you hear that Uganda has 100 districts, you will know it has 100 associations, small and big. And since the Act of Parliament now is on, actually, the main issue we have to address, we should ensure that these small associations are supported to come out into one big national association, like it is in other countries. Because if there is that national association, actually like it is in South Africa, these people would have governance structures and they would have a voice. Because when you look at the Act, it over empowers the minister. She's the implementer of almost everything, but she's medical, you know. And today you may have a minister who may not even want probably to hear the word tradition, you know. So that means on her part, it may not be a priority. Yeah. So the only chance we have in Uganda is natural chemotherapeutics, the one I'm heading. Part of our mandate is to support the ministry to help out in issues of traditional medicine until a time when they have their own council, which is coming soon. This traditional medicine setting through us and the Ministry of Health, it partners a bit with Ministry of Culture. There is local government, and under there, in their laws, they're empowered to come up with groups for business purposes. So these have been groups for business purposes. Yes, we can leverage on them and start from there, because some are well organized. You know, it's a matter of knowing how well to do it. Yeah. Currently, they function separately because there have been no frameworks to inform this modern health worker of their legalities, though we have a public-private partnership health policy, which was enacted in 2012, having a whole chapter on recognizing traditional herbal practitioners as public, as private healthcare providers. But of course, this other one I'm talking about that was recently assented to had to be in place for the other one to be active. So based on that one in 2012, there had been thinking or plans that these practitioners, they would be leveraged on to pass on messages to their clients, health messages, use of a condom, referrals if like HIV patients, not to completely keep patients to themselves. But because there was a lack of another law, this was never implemented. But at the moment under COVID, of recent, there has been a launch of a communication engagement strategy. This was as a result of the increasing community infections and COVID, where the ministry felt that people need to be empowered, that now you have to take health in your hands. And that strategy put in place engaging village health teams. These village health teams, part of them are traditional healers. I see it as a channel that can be leveraged to pass on these messages, because the VHT system here is very, very well laid out. Yeah. So this VHT key person, every village who will be passing on messages like prevention of COVID. I'm seeing it as a way where you can empower that one also to pass on other messages, probably linked to drug abuse, because that person is going to be of a particular level of education where they are able, and they'll be supervised by district health teams. That is as new as 2 weeks under COVID, but I think it's going to leverage other issues. Actually, capacity building in terms of giving information, if you show the pros and the cons, and also mentoring them into varieties to grow, because there are varieties that have lower bad side, like when you talk about cannabis, you can have a one with a very low THC. You just teach them. And when you talk about herbalists, we have a tendency of thinking that they are not educated. Here, some have PhDs. Yeah. Some have done chemistry. It's like an area, if you want to make money, the demand, people falling sick, and those who don't want to fall sick, you can serve either community. So we've not been having training institutions. But with this law in place now, we're going to have training. And with training, people get to learn. And once you give information, once you show them the payoff, they'll quickly pick it up. So the role of traditional health practitioners is going to greatly be in helping out in capacity building, in telling the people, even not only about the herbals, but the diseases themselves. There are many other natural products published on already, a lot of chemistry done, and what was missing was, where is the patient? Yeah, you look at safety and then you do. So we have here herbalists who submitted a number of samples for validation, and part of them are those drugs we are talking about. The Ministry of Health should leverage on this act to sort of formalize as if it's implementing, because there is need for the traditional health practitioners to feel like they are accepted, because lack of this act has been indicating as if nobody cares. So a formalization process to accept the traditional health practitioners is critical, but I believe it will be done because we have a program under COVID to expedite most of such things. And once that is formalized, then they can be tasked to start off with these messages, carrying messages, because we're having a challenge of messages not reaching to the deep corners of the country. And these traditional practitioners are amongst the population. If you give them trust for them, they will be so happy, and then tasked to carry on these messages. Simple messages, we can start with we can first start with the current challenge, COVID, and then we bring in those the drugs, the drugs demanded, because you want to start with the most current, and then you make your package. Yeah, thank you too for giving me this opportunity, because I believe what we've discussed is not only needed in Uganda, but Africa at large and the globe at large, because it involves business as well. Thank you.